Hi guys, so today I'm going to be doing a video about what is in my bag when I go to therapy sessions. I work as a behavior technician in ABA therapy, so I work with kids with autism. Currently I've worked with 3-year-olds, 4-year-olds, 14-year-olds, a 9-year-old, and 8-year-old. So it's not too far, but it's just kids. So basically, every session I go to, they're anywhere from 2 hours, 2.5, 3, 4. And 4 is like the longest session I've done. And during these sessions, we do therapy, behavior intervention plans, just kind of stuff like that. So in my bag, one of the first things I have is a planner. This is really important if you're in this line of work, just because sometimes schedules change. You don't have a strict work schedule. Sometimes the session times change because you're working sometimes out of people's homes, so you're doing therapy in the home, sometimes at the clinic. It just depends on the parents' preference and their schedule itself. But also, I'm a full-time student, so planners are a lifesaver. Next thing I have is this little mini binder. Basically, you can find them at Walmart, and then they have like these little papers. This is what I take notes on. Taking notes is really important, just to write down observations and just kind of key points of the intervention plan that your BCBA, your supervisor, assigns for that specific child, especially if you're working multiple cases, because it can get a little hectic and sometimes it's hard to remember all of the things you're doing with each kid. And also, if something happens in the session that you want to document, or if the parent has questions and you can't answer them, you write them down. You could ask your supervisor later. It's just a good idea to have some type of note-taking intervention there. Next thing I have is a first aid kit, and I also, on my keys, I keep a little CPR mask. This is good. So when you work with kids, you usually have to have CPR certification, and it's just good to have a little first aid kit that you can keep in your bag. You never know what happens. Maybe a kid throws a plastic toy at you and you get a cut. Band-aid. Next thing I keep is Germ-X. Kids are gross sometimes, so I put Germ-X on before I walk in. I give the kid Germ-X if mom says it's okay. And I Germ-X after I leave, because kids wipe their nose, pick their nose, they chew on their hands, and if they're sick, you're gonna get sick. Next thing, tissues. Never know when a kid sneezes and you're trying to do therapy. You don't want to walk away from whatever you're doing, whatever activity you're doing in that moment, so just have these on you. It's just a good idea. And then obviously writing utensils. Bring a few just in case your pen runs out. And the next thing I have, these are called token boards. So basically a little Velcro and tokens, and right here you put the motivator. So whatever behavior you're wanting to enforce from a child, if they participate in that behavior, you get a token, and they're working towards whatever motivates them. So after you get 10 tokens, do you want to watch TV or do you want to go outside and play? So it's just whatever motivates them and working towards the reinforcement. You don't have to use these. Actually, I'd also been using just paper token boards. So same thing, So you can use stickers with the paper ones, and kids love stickers, so really it doesn't matter which one you use. last thing I'm going to show is I'll bring toys with me, and these are just for activities that we're doing. So if the child participates in good listening by listening to instructions, they're focusing on the game. Oh, sticker. So it's just a good way to reinforce listening and compliance. So, and also it's fun, keeps the therapy fun. So, it's a little dangerous, but so that is basically what I have in my bag. Obviously I don't bring these every time. You can bring other toys, switch it out, use candy as a reinforcer, but that's dependent on what your BCBA thinks will work with the child. And this job is a lot of fun. It's stressful and it can be challenging, but it's really, really awesome when you're working with a child and you're seeing improvement, mom is seeing improvement, and it's just a great feeling to know that you're actually doing something positive in that family's life. So that is what I keep in my therapy bag. If you have any questions or any requests on video I should do based on school, on my work as a behavior technician, comment below and I will get those videos out to you.